Hello students, our today's topic is erectile dysfunction. Erectile dysfunction is a problem in which male is not able to erect his sexual organ. No need to worry about it. Frankly saying that no need to worry about it because in young ages uh, it is not a big deal. It is not a big problem because nowadays environment is like this. We have a lot of problems where we have a lot of tensions due to which we are suffering with such kind of problem. Don't think so that you have some problem with your sexual organ. No, I will tell you what is the etiology. The main etiology is your neurologically, maybe some kind of neurological problem in the body. So there will be erectile dysfunction. But the main etiology, the main thing, first thing is neurologically, second is your psychologically. Patient is mentally not prepared for sexual activity. Can you understand how is it possible? Yes, it is possible. If you have no money, for example, if you have no money to eat food, you have tension. Sexually, mentally, you are not prepared to do sex. How is it possible that you have nothing to eat and you are going for sex? No. Can you understand me what I'm trying to say? So the patient is mentally not willing for doing sex, so there will be no erection. Or secondly, the patient is mentally not prepared for sexual activity, right? Or psychologically, he have some kind of psychological problem that he can't do sex. This is also a main reason that he can just make a result about himself that he can't do sex because there is some problem with his sexual organ. Then after that we have some other things that first I told you neurological, then we have psychological, then we have hormonal, this and that. Then malnutrition also can cause this problem. So remember one thing: if patient came to you, right? If patient came to you, you done all the test, you check neurologically, he is okay. Psychologically, there is some problem. For example, limit. Neurological, he is okay, right? Physiological, he is okay. Then endocrine, he is okay. Malnutrition, there is no malnutrition. Mean to say, here is something. The patient is not able to do sex. He is mentally prepared that he is not able to do sex. At that time, no need to do any kind of treatment. Just give him some kind of placebo and say him this is Viagra. Use this Viagra, you will be okay. Even this is placebo. Maybe some kind of sugar pill, maybe some kind of vitamin. Grind it and give to the patient, so the patient mentally will satisfied that I am taking Viagra, I can do sex, right? But if there is some problem, neurological or hormonal, so you have to treat it. Meanwhile, what we can do, we can use some kind of Viagra, this and that, tadalafil, vardenafil, we can use this drug. The mechanism of these drugs are same as compared to nitroglycerin. Same to same mechanism of action. When you will take this drug, what will happen? In nitroglycerin, if you remember, it will convert into nitric oxide. Remember, I told you that in the previous lecture, I told you that nitroglycerin dinitrated into nitric oxide. But in this case, in vardenafil, tadalafil, these drugs increase the nitric oxide level in the body. Simple. This is the difference. That's all, right? So when you will take tadalafil, vardenafil, what they will do, they will increase the nitric oxide level in your body. When nitric oxide level will increase in your body, then CGMP level will increase. As I told you, all these things that it will go on to the sulfhydryl containing receptor associated with guanyl cyclase, right? So this nitric oxide will go to the sulfhydryl containing receptor associated with guanyl cyclase enzyme, so due to which there will be increased level of CGMP in your body. If there will be increased level of CGMP in your body, mean to say there will be vasodilation. If there will be vasodilation, mean to say there will be more blood supply. If there will be more blood supply, mean to say there will be more erection, right? But don't think so that nitroglycerin you can use to treat erectile dysfunction. No, because nitroglycerin within 5 minutes it have to show its full effect, right? But erectile dysfunction, if someone have erectile dysfunction, he have to do sexual activity. Nitroglycerin for 5 minutes. Either it is not, we can't use this drug in case of erectile dysfunction. For example, if you think that nitroglycerin we can use because it is also dilating the smooth muscles, so remember one thing, that nitroglycerin work only for 5 minutes. Secondly, it work in the heart muscles. Thirdly, nitro that thing, your tadalafil vardenafil, they will dilate the smooth muscles in the penile muscles, right? But mechanism is same to same. Only one difference that your nitroglycerin will convert into nitric oxide, right? And tadalafil will increase nitric oxide level in your body. Got the point? Remember one thing that not according to doctor, not according to a professional person, I'm saying to you, not to use these drugs because these drugs can do erection for 6 hours, 12 hours, 18 hours even. So normal, no one can do erection till 12 hours, right? Normal erection 30-35 minutes, maximum, for example, 40 minutes, right? But if you will do erection 6 hours, 12 hours, 18 hours, what will happen? It is unnatural. It will cause, if you will take permanent these drugs, it may lead to myomalacia of the penile muscle, right? If there will be myomalacia, I mean to say, after 6 months, 1 year, you will need double dose, right? And after some years, a point will reach that at that time, there the tadalafil, vardenafil will not work. By you taking these drugs, there will be no erection. What you will do at that time? At that time, you have to inject these drugs in the penile muscles, and minimum cost of that injection is about 10,000 approximately. I'm telling to you, 10,000 is the starting range. But nowadays, maybe 3-4 thousand are also available. But these are the very low cost. If the drug is low quality, mean to say side effects will be high. So if a poor person, right, he is also man, he want to take sexual activity with her wife, so he need 40,000 for 4 times, if just for 4 times in a month, right? Just for 4 times, if he want sexual activity with his wife, he need 40,000. So no, I'm not talking to you as a doctor. I'm talking to you just what we can say, just an advisor to you, that in your personal life, if you want to do with patient, it's up to you. In your personal life or in your family members or someone or friends told to you that what they have some erectile dysfunction, first make their pathological reports. If pathology is okay, then improve their diet, right? Improve their diet. If they are not willing to improve diet, then please use that drugs. But that drugs may cause hypertension, may cause eye disease, may cause angina also, right? Because these drugs can also cause hypoxia, same as anti-anginal drugs. They can also do your methemoglobinemia. They can also form. Don't forget about it. So this is the mechanism of action of anti-anginal drugs. Till next class, thank you so much. So nice of you for listening. Thank you.